All hands on deck to stop Ebola at the border. After the U.S. and Britain, France announcing airport screening for passengers coming from Ebola-stricken West Africa, a life-saving measure or a placebo designed mostly to stop the spread of fear? The infection of a second nurse in Dallas, Texas, the one in Madrid, after caring for Ebola patients, stoking that fear. How did they catch it? What's the real risk of contagion in the West? And our government's doing an effective job on informing the public. The same question can be asked of Liberia and Sierra Leone, where government initiatives have so far failed to contain fear, or for that matter, the disease. Liberia, where striking health workers feel exposed and exploited. Today, in the France 24 debate, we're talking about the spread of fear. And with us from New York, he's worked on Ebola at the Center for Disease Control. Joseph McCormick is the dean at the University of Texas's School of Public Health. Thank you for being with us here in the France 24 debate. She's formerly with
My pleasure. Thank you.
She's formerly with the French Ministry of Health. Florence Allot of corporate consultants Deloitte France. Thank you for joining us. Virologist Jonathan Ball of the University of Nottingham. Welcome back to the show. And from Freetown, Sierra Leone, journalist Umaru Fofana. The France 24 debate, where you can join the conversation on Facebook and on Twitter, our hashtag F24debate. For the second day running, the U.S. president's clearing his schedule to deal with the Ebola crisis. The White House putting out a tweet late on Wednesday to calm Americans. In it, it reminds people that a patient must have symptoms to spread Ebola. 21-day incubation period is also pointed out in that tweet. But the second nurse infected in Dallas also has the White House declaring a, quote, more aggressive response to the outbreak.
As soon as somebody is diagnosed with Ebola, we want a rapid response team, a SWAT team, essentially, from the CDC to be on the ground as quickly as possible, hopefully within 24 hours, so that they are taking the local hospital step by step through exactly what needs to be done and making sure that all the protocols are properly observed.
All right, there he's talking about CDC SWAT teams. Joseph McCormick, before I ask you about the substance of what you just heard, is the tone employed by the U.S. president reassuring to Americans?
Well, I would hope so. I think most of the fears that people seem to have are completely unfounded. And many of us who have dealt with this disease firsthand, both, and for me, both in the field and the laboratory, we know that we're not going to have an Ebola outbreak in the United States. We may have some secondary cases, but certainly I wouldn't have expected them to be in healthcare workers.
But that said, we're seeing what? In the last couple of days, stories, the second nurse who flew on a plane just before the symptoms were declared. It seems as though the CDC perhaps declared victory too early a couple of weeks back when they said it was all under control.
I think that was part of the issue. I think part of it is everybody took a big breath and said, wow, it's all under control, we don't have to worry about it. And so they went about their business, and I think people didn't take it too seriously. There's a bit of overconfidence, and perhaps on the part of the CDC as well as others. I'm totally confident that we will not have an outbreak. And, you know, I think that all of us who've worked with this keep saying, look, this is not airborne. The transmission rate is not high. It's around 10% of people in contact. And I think this is very well illustrated by the fact that so far, all of the contacts of the family, no one has become ill, and we're close to the end of the incubation period. Yet we have healthcare workers, 2 of them so far, who have become ill. What does that say? It says that the procedures, the protocols and procedures used when these folks were caring for Mr. Duncan were flawed. And I think that's what needs to get fixed.
The procedures were flawed. Jonathan Ball, are you surprised that the procedures were flawed?
I was very surprised to see 2 and then 3 cases of infection in healthcare workers, particularly in the West, because it really shouldn't happen. We have the equipment, we have the protocols that should protect healthcare workers from this. So clearly there has been a problem. There's been a breach in containment. I think that really what needs to happen is that we need to compare very carefully and look in detail how the measures are designed to work, whether or not those measures can be improved. And I don't wish to blow the trumpet of the UK approach, but here we see the patient is isolated, and therefore any virus is contained, and then that means that there's less risk for those who are working or looking after the patient. And I think we need to look carefully about whether or not it's right to isolate the patient or to protect the healthcare workers. But unfortunately, it's not always possible with the equipment that we have to isolate the patient, to remove that sort of environmental contamination risk.
The New York Times on its website publishing a video on how to remove protective suits after contact with an Ebola patient. Jonathan Ball, are you surprised that it could well be that these nurses didn't follow the procedure?
They obviously didn't follow the procedure, or indeed the procedure is very difficult to follow, and I think that's a key thing that we need to look at. So really what we need are procedures that are reasonably easy to adhere to, and I think linked to that is to ensure that anybody who's dealing with an Ebola-infected patient has adequate training and fully understands the risk, because infection of healthcare workers in the Western world just shouldn't be happening. And I think that is the surprise in all of this, not the fact that we've seen infections exported from Western Africa.
It shouldn't be happening to nurses.
Let me suggest.
Go ahead, Joseph.
Let me suggest that we look at what's actually happened. So we've had patients go to Atlanta, to Emory University, and we've had patients go to Nebraska, to the center there, and we've had no secondary infections. When you look at the details of the procedures used in Dallas and the personal protective equipment, it was flawed. And the procedures for taking the garments off particularly was flawed. And I won't go into the details, but I can give them. And so there is where we've seen 2 infections. And so it's quite clear that it wasn't the issue that the patient wasn't isolated, although there was a period of time when the patient was being waiting to be put in isolation. None of those people have gotten infected who came in contact with him then. So I think it's clear that the procedures, and we don't know exactly which procedure, but I think we have a pretty good idea. The procedures that the nurses were using were flawed.
You're whetting our appetite here, Joseph. What exactly was flawed?
It was the protocol that was flawed, not what the nurses did. It was the protocol itself for taking the protective gear off, in my opinion, and also for some of the procedures in the isolation area, which, in my opinion, were flawed.
Let me ask you about this, Florence Allo, because we've seen in Madrid, the nurse who falls ill, this is at Spain's top infectious disease hospital. We have a case this Thursday, a suspected case. It's not confirmed, in a Paris suburb. Again, it's a nurse. The health minister is not commenting at this time. We've had a lot of false alarms over the past couple of weeks. But again, it's a nurse.
Yes, well, we know that the disease is really at risk for healthcare practitioners, and they have procedures to follow, but those procedures are really difficult actually to respect. So, what we can say after those kind of after what we have observed here is that maybe there are gaps in the way procedures are applied by healthcare professionals, and there is really an issue in training the healthcare professionals with those procedures. Even if nothing is happening at the moment, healthcare practitioners really have to be trained to put the biohazard suits on them and to put up the gloves and everything in a secure way. There is really, maybe the procedures have to be revised. I guess that experts might think of it at the moment to make it easier to follow, or also to make it more efficient. But there is an issue in training practitioners.
Jonathan Ball, when you see how delicate this procedure is here in Europe, is it mission impossible protecting healthcare workers in West Africa?
It's certainly far more difficult in West Africa because the demands on the healthcare workers are far more intense. They're seeing far more people infected. The shift lengths that we've heard are very extensive. We often hear that, you know, healthcare workers are at the sort of end of their tether trying to deal with this problem. So it's not surprising to see healthcare workers being infected in Africa. It's tragic, but I think it's bound to happen purely because of the number of infections and also the facilities and the hardships that they have to operate under. And so really it does, I think the focus then shifts as to what can we do to protect the few healthcare workers in the Western world who will be looking after these sporadic cases of Ebola virus infection.
All right. The emergence, by the way, of a second case in the United States, as we were saying, it's prompting a lot of fear. The Daily Caller publishing a snap of a passenger at Washington's Dulles Airport. We could perhaps call it up, where you see complete in gear at the terminal. What's your reaction when you look at that photo, Florence Allot?
Well, we can understand that people are frightened seeing that. It can, of course, bring fear and panic amongst the population.
What does it say about the way that the disease has been explained to the public?
Well, what is surprising is, for what I know, there has been a lot of explanation since the last month about how the disease can be transmitted and what are the stakes and the issues about the epidemic in West Africa, and also how the European and more developed countries are equipped to face with that. And I would have expected people to be less likely to fall under panic and have so much fear in front
Joseph
of that.
McCormick, it's been, what, 3 weeks since we knew, maybe more, since we knew about that case in Dallas? It's been top of the headlines since, and yet it seems like the message isn't getting through to people that it's not an airborne disease. Are you surprised as well?
I wish I were, but I think what's happening is that people look at the images coming from West Africa, and some people, some are not nearly as worried, but some look at that and say, oh, this is what's going to happen here. And of course, we know that's not going to happen. But let's examine for a moment what the experience has been with Médecins Sans Frontières, working with Ebola now for many years. And we know that prior to the outbreak in West Africa, that MSF has had tremendous success with their procedures. And if you go on their website and look and see how they use their personal protective equipment, you will see a very effective way of protecting themselves. And they never had a single healthcare worker become ill until the outbreak in West Africa. Let me just say two things about that. One is we have an absolute sea of virus in the two cities, particularly in Monrovia and Freetown. And secondly, and MSF will, the website of Médecins Sans Frontières says very clearly that those few healthcare workers that work with them who have been infected have become infected because of some breaches in their protocol, and particularly on removing their gear. So this is the most complex part of it, and it only takes a slip when you're taking the gear off, because that's when it's infected, that could result in infection. So I would say that Médecins Sans Frontières has been absolutely superb at being able to encounter patients with Ebola in the most rudimentary circumstances, and they have been spectacularly successful at preventing infection in their healthcare workers.
A lot of reactions, by the way, coming in to the show from viewers. One from Veronica on Facebook. Airport screening only on planes from Guinea is not enough. Guinea, of course, Sierra Leone and Liberia, the three countries. And that brings us to one of the essential questions. Jonathan Ball, this Thursday, the European Union saying it's going to launch an immediate review of exit screening in Ebola-hit African states. We've seen here in France. We've followed Britain and the U.S. now. There's screening at the airport. And yet, Jonathan, the World Health Organization is casting serious doubt on whether screening at the airport helps at all.
I think we need to differentiate between exit screening, so as they leave the 3 affected countries. Obviously, that's very important to ensure that individuals who are showing symptoms aren't carrying the virus outside to the rest of the world. In terms of entry screening, I think the reality is, and you touched on it at the start of the programme, that this is probably as much to reassure public as it is to have any serious public health intervention, because the reality is that the person would have to develop symptoms during the flight or during travel. And even then, there is a large window. You've alluded to the fact that the incubation period can be up to 21 days. So there's a significant window of period where somebody who has the infection can travel to a country and then develop symptoms. And the reality is that in the cases in Spain and also the US, in those cases, it's either been the fact that we knew that people who were carrying the virus initially were infected because they were identified out in Africa and then repatriated. Or indeed, in the other case in the US, this is somebody who apparently, and I don't know the exact details, but apparently turned up to hospital, explained the travel history with very early symptoms, and unfortunately wasn't treated or isolated at the time. But it's very important to remember that this is a low contagious virus. It's not going to spread very easily in the communities. It's reasonably easy to identify, particularly from travel histories and from the symptoms, and therefore we are unlikely to see major outbreaks in the Western world.
Unlikely to see major outbreaks in the rest of the world. I want to pick up on this point about travel and whether, in fact, you quarantine West Africa. It's been proposed by some lawmakers. Stay with us. We're going to pick up on those points when we come back. It's the France 24 debate.